Turning now to new concerns about the Ebola outbreak in Central Africa. At least 220 people are suspected to have died already, with more than 900 possible cases there. Oh, no. Dr. Celine Gounder is a CBS News medical correspondent and editor-at-large for public health at KFF Health News. She also, by the way, was an Ebola aid worker during the West African epidemic. That was back in 2014. So you know this subject very well. Really glad to have you here. You know, it's kind of scary because world health officials say it's going to get worse before it gets better. What are they talking about?
Well, one of the problems we're facing right now is the lack of workforce to do contact tracing. So the key number here is only 1 in 5 contacts are actually getting follow-up to see if they have Ebola. Do they develop symptoms? Do they have a positive test? In the absence of a vaccine or specific treatment, all we have is contact tracing and isolation. So we're really behind the 8 ball here.
Why is it important? Why is contact tracing so important to containing this?
Right. So this is really the only way to stop transmission, given what tools we have at our disposal. So with contact tracing, you go to everybody's door, you check on them, you see if they have symptoms, you check their temperature, you offer testing, but they've even run out of supplies for testing. So if you don't have the people to go follow up, you don't have the supplies to do the testing, you know, how are you supposed to contain this?
All right, so Uganda reported 2 more cases. How concerned should we be of this spreading, especially with the World Cup coming up? You got U.S., Canada, Mexico. I mean, it's going to be a lot of international traveling.
Yeah, well,
talk about the travel restrictions. Do you think that matters?
Well, they're not very helpful. And it might seem obvious, oh, of course, you just shut the borders, you're not going to have transmission. But what we've seen actually with prior big outbreaks, whether it's Ebola or COVID, you're only preventing about 1% of the transmission that you might otherwise see. And so what happens is people are driven underground. They find other ways of entering countries. So they might travel over land, or they might make multiple flight connections, so it's harder to trace. And so it actually makes the whole issue harder to contain.
So do you think we're ready for the World Cup, realistically? And what can we do? What should we do?
So this is the largest mass gathering in U.S. history. And as you mentioned, Nate, you know, 3 different countries, over 5 million tickets have been sold, 16 cities, 39 days. This is massive. I talked to the guy who does health security, runs health security for the Hajj pilgrimage, which is also another massive event, smaller, by the way, than the World Cup. And he said, you know, normally you have a chain of command, you have a command center, you have real-time data. We put $0 as a country into biopreparedness for the World Cup. We put in $625 million for law enforcement and security, 0.
So what do we do?
That's concerning.
Yeah, that's very concerning. What do we do?
Well, state and local health departments are trying to do what they can, but they have no new money. So, you know, they're a little bit cash strapped and workforce strapped here.
So be cautious is what you're saying.
Be cautious.
All right. Dr. Gounder, thank you so much.